All right, gang, here's your dedicated doctor on vacation, but not forgetting about the dermatology couch. There are a lot of questions to answer about pigmentation, and this is very apropos as the sun is setting, both on today and the summer as a whole. It's not only sun that causes pigmentation, but also any inflammation, pimples, rashes, hormonal pigmentation like melasma. There are so many causes of hyperpigmentation, and there are so many treatments. All pigment is not created equal. So I'm going to answer some questions, and that's it. Let's get to it. Pico is a great laser to remove sunspots. Consider the Fraxel like Windex and the Pico like a spot cleaner. It could also be used at a deeper setting, the Pico, for other types of pigmentation like melasma. Medication for melasma, severe melasma. Tranexamic acid is a great medicine we've been using for the last few years. It was originally used for women with heavy periods. At a low dose, it could work on various types of pigmentation, really best in combination with lasers and topicals. You can do laser hair removal if you have melasma. You must have it done with the right laser by the right provider, because any inflammation of the skin could certainly exacerbate melasma. PDT for sun damage. PDT is a great treatment for medically significant precancerous lesions. It will have some cosmetic improvements, certainly not as much as Fraxel resurfacing. You can use them in combination. You know, topicals aren't great as a sole modality for sun damage. They're great in combination. There are plenty of serums over the counter and prescription that can be helpful. Lasers, these are kind of going to do the best job. You know, doing any laser treatment tan is probably not a good idea, particularly if you're trying to remove the sun damage, right? There are certain lasers you can use on tanned or darker skin, but I would always try and be as pale as possible when you get any treatment. Treatments can really be tailored depending on how much downtime you want. Obviously, there's a bit of a no pain, no gain. If you're looking for really low downtime treatments, you will need several, but a really good Fraxel treatment and combination laser treatment would last about 4 or 5 days to do the job. Sun damage treatments, you know, they should be uncomfortable. They should not be painful. Topical anesthesia, any type of oral sedation, you should really not be put in a position where it should be painful, because sun damage is really in the superficial layers of skin. You could absolutely treat sun damage on any area of the body. It's not just the face, neck, and chest. You know, BBL Hero is really great in that. You do heal slower on the body. It does take longer to heal, and you do need a few treatments, but it's very effective. This is a myth. Lasers should not damage or increase the risk for skin cancer in moles, and sadly, lasers are not a good option to remove moles either, which a lot of people want to get removed, but usually it goes too deep. You know, sure, chemical peels are still very effective. I like lasers better. They're more specific, used in combination. In my opinion, you could accomplish a lot more with less downtime, more predictability, and safely, but there are certainly people who use chemical peels. No, CO2 is not necessarily better. CO2 is better for textural, fine lines, acne scars, sun damage, and most forms of pigmentation of all kinds are in the top layers of the skin, epidermis or dermis. You don't need such aggressive. Generally, I say monthly. You know, you want to give time for the skin to heal, see what you get, make sure there are no complications, and to let the skin rejuvenate in between if you need multiple treatments. The right lasers are safe. Long wavelength lasers, you can use Fraxel technology also. You have to be cautious. It must be done with an expert provider. There are certain safety concerns with darker skin. You should not be tan, and you should definitely be out of the sun for a few weeks. It's at 2 or 3 weeks after a laser treatment that someone can get rebound pigment or post-inflammatory changes. So you really got to be careful in the sun. This is another tall tale. Lasers should not thin the skin. In fact, they should build collagen, improve elasticity, reduce medical sun damage, and improve the health and thickness of the skin. The fact that lasers thin the skin is not right. No, you cannot treat skin cancers with lasers. You could prevent skin cancer, minimize skin cancer, treat pre-cancer, actinic keratosis, but if you have a basal cell, a squamous cell, a melanoma, no bueno, no laser. No, the modern day laser technologies do not make the skin that shiny white color, which is more associated with the old phenol peels and continuous wave lasers of yesteryear. So no. Can we get everything removed in one treatment? I don't know about that, but with the right combination of lasers, if patients give me a good 4 or 5 days of downtime, we can make a good 85-90% difference. Laser treatments for sun damage are permanent. It's not they wear off like injectables or other things, but the question is how much damage was done in the past and how much maintenance will be required because new stuff keeps coming out. Most people get a Fraxel a year. Home remedies. There really are no home remedies. Certainly sunscreen's the most important, but there are a lot of over-the-counter and prescription topicals that can help the process. Tranexamic acid's a great one. The hydroquinones and the Arbutins can be potentially irritating and sun sensitized. Why are some skin types more susceptible to brown spots than others? I mean, listen, all skin types are susceptible to the effects of solar radiation. They just represent it different. Obviously, people are much higher risk if they're fairer skinned. Friends, that about wraps it up for skin pigmentation questions part 2. I'm about to get back to vacationing and get some rest, but I'll be ready for all your skin pigmentation needs when I get back to PMB next week.